So, hello everyone. Welcome to our third annual 2024 Mentorship Program closing meeting. I want to start off by welcoming all of the attendees. Thank you so much to everyone that was able to make it today, especially the mentees and mentors. So before we get going, I'd like to share a few slides about the program this year and the evaluation that was conducted. So this year, we had a total of 8 pairings. This year's pairings are shown on the slide here. We had a total of 8 pairings with 1 mentor serving 2 mentees. So thank you again to everyone on this list for your participation. Let's take a look at some of the deliverables that were completed or are in completion. Our pairs worked on a range of projects from career guidance to developing research papers to launching an MMDP program. Lastly, thank you to everyone who filled out the evaluation form. We received great feedback. So here you can take a look at some of the comments that we received. It's great to see the positive impact that the program had on you all. So as you can see, our participants enjoyed connecting and collaborating with individuals across the world and learned a lot from each other. Common feedback that we received was that you all would like the opportunity to supplement the program with online training on online platforms. And you would like to extend the duration of the program for more than 6 months. So on today's agenda, we have 5 pairs presenting today. Each pair will have 6 minutes to present with some time for Q&A afterwards. So with that being said, let's dive into our first presentation for this morning, Dr. Tadjidine Youssouf. So Dr. Tadjidine, would you like to come on? Yes, I will be sharing my screen now. Can you hear me, Dr. Tadjidine?
Hello.
Hi, so I'm going to be able to share my screen for you so you can present.
Yeah. So I already shared my presentation since yesterday.
Yes.
You can project. Yeah. Okay. Thank you very much. I can begin?
Yep. Go ahead.
Okay. Thank you so much. So thank you so much for your presence. And this is closing meeting. I would like to thank my mentor, Professor Suma. And we have worked following slide, please. About management, morbidity management, and disability prevention. So we focused on the status of morbidity management and disability preventive program in Comoros. This is my area of competencies of intervention. So this is our project topic, because we wanted to eliminate program filariasis, lymphatic filariasis in Comoros. So we are ongoing to eliminate. So we did one meeting per month with my my mentor, Professor Suma. Following slide, please. So after morbidity management, after topic about morbidity management and disability prevention, I learned many things with my mentor. For example, massive drug administration coverage, and we discussed about reducing never treated population in Asia. And we talked about the lack of awareness, the gap of awareness. And we discussed yet about no respondent, about MDA. And so we noted that population hasn't taken drug represents 9%. So we talked about caste and ethnic group specific problems, and Muslim obstruction, and the problem about seasonal in country migration, and social mobilization. So we noted that never treated population higher among age group 18 25 years old. Please, following slide. So in Comoros, where are the progresses? So now we are going validation of the National Master Plan for the integrated fight against NTDs, neglected tropical disease. But the morbidity management and the disability prevention activity has not yet been implemented. So we have a positive aspect, because I have already been trained in Brazzaville about morbidity management and disability prevention. Following slide. So what are the deliverables? So now we already have the request for morbid case management and disability prevention activity submitted to the Ministry of Health, and then to the local WHO office, morbidity management and disability prevention national focal point training in Brazzaville. I have been already trained, and we have WHO agreement on the mobilization of an international consultant to carry out morbidity management and disability prevention activities. So I had 6 minutes. I think I'm on time, so I apologize if I made some mistakes. So your contributions are welcome. Thank you so much to my mentor Suma and all persons who participated in this mentorship. Thank you so much.
All right. Thank you so much, Dr. Tadjidine Youssouf. So now we have some time for questions and comments. So would anyone like to ask any questions to Dr. Tadjidine? Yes, Hafiza, go ahead.
Thank you, Frisa. Hi, Dr. Tadjidine. Thank you so much for the presentation. Since you and your mentor talk about the MMD and MDP and L in lymphatic filariasis, it reminds me I'm from Indonesia, and as you know, as everyone might know, that Indonesia is still struggling with the lymphatic filariasis in several endemic areas, which is in the context is actually on the several district. And one of the agenda that our ministry has been doing is translating the international MMDP guideline into the local context, on which we have found challenges on translating the term, because some of the term which is used standardized internationally apparently is not commonly used in local context. So would you like to share, or do you have encountered similar challenges, or whether your country also adopt the international guideline on the MMDP to the local context as well?
Okay. So I think this is the main challenge. The act we haven't yet implemented the DDP program. So this is the EOG program, and I deplore, I regret, and the late the late side from our Minister of Health, but we have already elaborated the request. So this is the EOG program. We have to firstly train our physician and our paramedical, our health workers, community health workers. This is a big challenge. This is big challenge, and this program is not yet implemented. I recognize our late.
Thank you, Dr. Tadjidine.
So we have time for one more quick question before we move on to Cristina Juan. Does anyone have any other questions? Okay, so now let's move on to Cristina Juan. Cristina, I'm going to be sharing my screen for you. So if you could just come off of mute.
Okay, thank you. Well, good morning, everyone. My name is Cristina Juan, and I'm really happy to be here. First, I would like to thank iCHORDS for the opportunity to be part of this mentorship program. I really enjoyed this experience, and for me, it was a wonderful opportunity to meet other people that are working on the field of neglected tropical disease and to learn for them. The title of my project is The Role of a Community Health Agent to Support Patients with Chagas Disease. Next slide, please. My mentor is Marina Wall. She works at Mundo Sano Foundation, and she has a PhD in political and medical anthropology. The topic of the project was the barriers to healthcare in Spain for patients with Chagas disease, and the role of a community health agent in support and helping patients to address these barriers. It was we did a qualitative research, and we did a total of number of meetings. It was around 9 or something like that. First, we share our interests and expectations considering the duration of the mentorship program. we decided that it would be really nice if I can connect with the team of Mundo Sano Foundation in Argentina and Spain to know what is going on, the project that they are doing. And we decided to define the research focus on Chagas disease because they have a project here in Spain, in Madrid, with a community health agent, and they have already a project in the is ongoing, and they want to know what happened with this community health agent and what is the who can do that and what is the role of this community health agent in supporting this patient. I visit the team in Spain, in Madrid, and I also meet the community health agent. And as a part of the field work, I developed some interviews and also a focus group with patients with Chagas disease that are living here in Spain, and with health workers from diverse health facilities in the community of Madrid. Monthly, approximately, we have monthly meetings to monitor the progress. And after I analyze all the information related to these interviews and focus group, they have already done 10, and I analyzed that. And I did another maybe 20 more. In total, there are at least 30 interviews with information of this patient, with information of the health workers. And I also did the manuscript writing. And now there is the phase of the revision of the manuscript, because this project also involves other partners in the Hospital La Paz Carlos III and other research that are in that hospital. Next slide. Well, the first meeting was in September, the second in October. In November, we also have the third meeting, and I visit the team, as I mentioned before, in Madrid, and the Bolivian consulate, because the community health agent also did some work there twice per week. And in December, we also have the 4 and the 5 meeting, and I did a focus group with patients with Chagas disease in order to analyze the experience of patients, that the barriers that they face here in Spain, and also the perception about the Chagas disease and well. And also I performed some interviews with patients and health workers, normally online or maybe in face-to-face. And in January, I also visit the Hospital La Paz Carlos III to know Carlos III in order to meet the other people involved in the research, and also to interview some of them. And we did the 6th meeting and the 7th, and I also continue with the interviews for patient and health workers. And finally, in February, we have the 8th meeting and the 9th, the last one. And I interview one health worker that I missed to interview in January because he wasn't available. Next slide. Well, as part of the deliverables, it's true that, well, during this project, we see that the methodology, it was mixed. It was quantitative and qualitative, but we changed it, and for this time being, the methodology in this project is only qualitative, and also we did some changes. That's the reason why we decide to submit these new changes to the review committee for approval. And as part of the proposal, one of the key decisions was that it will be really fine if I can be the co-IP of the project, taking into account representing the Mundo Sano Foundation, taking into account to highlight a little bit the role of this foundation in the development of the research. Also, additionally, I wrote the manuscript, and as I mentioned, this manuscript is currently under revision for the other research involved. And we plan to submit it to PLOS neglected tropical disease maybe in April, May, we don't know. But well, and that is all. I want also to say thank you to Mundo Sano Foundation, because it was a great opportunity to meet them and to perform and improve my skills. And well, that's all. Thank you. If you have any question.
Thank you so much, Cristina. Super interesting project. Does anyone have any questions or comments for Cristina?
Hi, this is Elizabeth Long. I have a quick question.
Yeah.
Thanks. So my question is you we're obviously focused on Chagas disease here. Do you think that sort of the approach that you took could easily be transferred or something similar to other NTDs that people might be encountering and trying to treat in Spain or other countries?
Yeah, I believe that it could be used, but it depends because the cultural context influence very much on the perception and the vision of people about the illness, no, the disease in general. And I believe that in this case, this is we consider that Spain is a not endemic country of Chagas disease, but after we have a lot of migrants that are living here, and well, I believe that it depends. And also we have a specific health system that is different from other place. And well, maybe we need to adapt the research to the context, to the local context where we perform different type of qualitative analysis, in my opinion.
Thanks very much.
Right. Thank you so much, Cristina, again. Now we can move on to Samuel. Sorry. Yeah, Samuel. Samuel, would you like to share your screen or would you like me to share the presentation for you?
Okay. Can you see my screen?
Yes, we can see your screen.
Oh, okay. Thank you so much for the opportunity given to me to be mentored by my mentor, Mr. Alexander Quatin. So he has expertise in grant proposal writing. And we decided to write a research proposal on the topic determinants of community drug distribution, distributors' attrition rates in the Ahafo region. And then after that, we had 3 number of official meetings for 3 consecutive months. But there are some other times that we had to meet unofficially. So this was our work plan. We had meetings to decide on the research topic. And we also plan on the meeting dates that we are also going to be having our meetings. We also planned on consulting with the local research team and also to conduct literature review on the topic. And we also had to review the proposal with the local research team that we had to be working with. So this was our Gantt chart, which shows our plan of activities in terms of conducting writing a proposal that we have to submit for support so that we can carry out the study. We plan on starting in October to December 2024 with the proposal development, and then also continue with pre-testing somewhere from December 2024 to within December 2024, and also start our data collection within December. And then also continue with our analysis in 2025, and then also end in somewhere May 2025. So that was our research plan that we had. So afterwards, this was our timeline and then the activities that we've been able to carry out so far. In September, that was when we had our planning meeting to look at the dates that we'll be meeting and when we'll be consulting with the local research team, and also to finalize the topic with the research team. And they also commence the draft of the proposal. We're hoping that in October, we were supposed to we were to conduct the literature review on the topic, which we have done a bit of that. And then in November, we had to draft the proposal. So we now currently have the draft of it. Currently, since December, we were doing the review. But now, once in January 2025 and February, we haven't been able to do much because we have to start with our annual performance reviews. Mostly, there's always a lot of pressure that we have to work on that. So currently, we are combining this concurrently with that. So these were our deliverables, and then the outputs that we've done so far were to identify a research topic. Currently, we've identified one, and we're to also engage with our local research teams so that we can commence the study, which we have done. We've been able to contact the local research team. We've met with the directors, and then we have also met with the program leads in terms of neglected tropical diseases. Then we currently also have a draft of the research proposal, and then that's the initial draft, which is complete. And then we are only left with a few things to fine tune. We're also to identify a funder. Currently, we haven't been able to identify a funder yet. So hopefully, we hope that after this mentorship, we will still look if there's a way that we can find a funder that can support us to carry out the research. That'll be fine. So thank you. And I also take the opportunity to thank iCHORDS for giving us this opportunity. And I also thank my mentor for taking time out of his busy schedule to mentor me in grant proposal writing. Thank you.
Great, thank you, Samuel. Sounds like this was a very wonderful collaboration. Does anyone have any questions or comments for Samuel?
I have a question.
Yes, go ahead.
Yeah, but I haven't understood why in Ghana until now they haven't identified the funders, because they know partner WHO and other partners in about partners engaged committed engaged to elimination about NTDs. So I don't understand. They are late about identification of funders. I think in the order we know the partners who are engaged about elimination of NTDs. I finished, please.
Okay. If I understand you,
it's clear.
if I understand you perfectly, you mean why we've not yet identified funders yet? Is that correct? All right, fine. If that's what you mean, that's actually, as we were working on the proposal, we've done it. We are just at the end stage of it, the final touches of it, but we are still looking at funders. We haven't been able to look at who we are to submit it to yet. And since you've mentioned WHO, that's fine. So we will look at it. I think that will have to be discussed with my mentor and then also with the local research team so that we see if there are specific partners that within the local area that are working on elimination of NTDs. that one, we can tender it through that. But as at now, we haven't identified specifically a funder that we can submit it to. Thank you. I don't know if this answers your question.
Any
Just added, Varsa just added in the chat, TDR is a place to keep your eyes out for small grants for research. And also IDRC in Canada will sometimes have a specific call for this sort of thing. So those are both good websites to just keep on your radar. Thank you.
Thank you so much.
Please, I have another question. Please, in Ghana, have you engagement, a commitment of governments, especially Ministry of Health, about elimination, NTDS elimination?
Yes, Ghana, we have commitment. Government is committed to supporting regions and then districts to help in taking steps that can help in the elimination of NTDs. But it's not all the times that they are able to do most of the things. You know, community health volunteers, as we already know, how they contribute to ensuring that we can eliminate NTDs. However, though government can do its part by providing us, supporting us with the ivermectin and then the other drugs that we can give, praziquantel and others, but you may not be able to give us funds that you can use to conduct maybe a study, a research. Mostly they are not able to provide funding for research activity directly for those ones. So actually we discussed this one thoroughly with the local research team, but that one we couldn't make a way out on through that. Thank you for your question.
Great, thank you, Samuel, and I wish you all the luck with identifying funders. Next up we have Matthew. Samuel, if you would like to stop sharing your screen now. Matthew, would you like to share your screen? Okay, so I guess Matthew might be having some connection issues. We could move along to Stella now. Stella, would you like me to share my screen?
Please do. Thank you.
Okay, great.
Please. Okay. Thank you so much. I am seeing the screen. So let me know when to start.
Go ahead and start.
Okay. Thank you, team, and thank you for making this happen. The iCHORDS mentorship program. I'm presenting on behalf of my mentee, Rachel Kramer. She's not available because she's doing exams and she couldn't be here. And Professor Stella Neema from Makerere University. Next slide. So what we did with Rachel is that she already had a dissertation and she wanted to extract a paper, a manuscript out of the dissertation. That's why her overall project is transforming undergraduate thesis. And the thesis was about schistosomiasis and soil-transmitted helminthiasis prevalence rates in rural Ghana in the hard-to-reach areas. Next slide. And of course, there were quite a number of themes, issues, quantitative, qualitative, biomedical, scientific slides that she needed also to work on. So overall, it had 202 pages, and she wanted it to be 62. And then out of that, after that elimination, she can see which papers. And in fact, when we started, she really intimated to me that, let me know if you think I have multiple publishable items within this paper. And indeed, they were like 2 or 3. So she wanted to refine the literature. The methodology was still in form of a dissertation, including data analysis, the discussion, and she wanted really to improve on conclusions to emphasize broader impact. Next. So again, there was this theme on microscopic refinement that included removing the maps. She had all sorts of maps and figures, even figures that were not from her study. So she had to remove some of those, as you see, even tables, and replaced with written phrases because it was just a bunch of so many things. Okay, next. So after doing that, ours was really back and forth, the progress and accomplishment. So she has drafted a revised introduction and background sections. She has incorporated most of the feedback on the manuscript and identified the gaps. There are quite a lot of gaps, and he addressed them, like the qualitative component was not coming out clearly because it wasn't really clear, especially in the methods. So she's working on that. She's saying, made wonderful connection with my mentor. Thank you, Professor, for all your advice. Next page, please. Next slide. Next step now, when all is said and done, when we moved back and forth, the immediate next step is finalize the manuscript revisions, conduct additional data visualization for the results section, because there were quite a lot of results. Then, of course, prepare a cover letter and submit the first manuscript. And we discussed about the journals, the possible journals. And of course, the first one that came that she thought about was PLOS, Neglected Tropical Diseases, and then the American Journal of Tropical Medicine and Hygiene. Next. So it's a sincere thank you. She's thanking you, and a heartfelt thank you to me, the mentor. So now, of course, the time really is not enough, when you are writing a paper. So she's still going on, and she requested if I can continue to mentor her. And I said, definitely, I'm ready to continue so that you churn out the deliverables. Thank you.
Thank you, Stella. It sounds like you guys made a great connection. Does anyone have any questions or comments for Stella?
This is Allison. Hi, Stella. Great to hear how things went for you in the program. And I was just wondering, you know, that's a huge amount of work to reduce an undergraduate thesis. So I really appreciate that you took that on with your mentee. I was just wondering, like within the mentees program at university, you know, did they feel they were getting enough support from their own supervisors, or did they sort of see this as a really additional, more technical support than they were getting from the university? I'd just love to hear your perspective on that.
Because I didn't get a chance to interact or to discuss with the university, but even before she sent me the document, it had also some comments from another, I think a supervisor or mentor or somebody else. And that mentor was not a qualitative specialist. He was more in the science, in the understanding the slides, understanding the what when they are in the what should I call it? Like the science of it all, the slides, reading the slides, because it was both quantitative and qualitative. And so for him, he was more on that side. And maybe I thought that could have been maybe from their university. I didn't bother to ask. But for the qualitative aspects, it was really an initiation. It was really missing quite a lot in the methodology, which we looked at. And he's going to blend the two, the qualitative and the quantitative. And the quantitative aspect, it was the other, I don't know whether it was there from the university or another mentor, but at least that one was a specialist in that area.
Yeah, that's really helpful. And it sounds like we couldn't have paired you better. That was a really great match for you and well, for your mentee to be able to lean on your advice for that. So yeah, that's excellent. Thank you for my question. And thanks, Stella.
Welcome.
Any other comments or questions?
Just to say, I think it would be interesting to display to present the varieties of soil transmitted helminthes and schistosomiasis. So about a number of cases.
They are there in the dissertation.
I haven't seen the varieties, the number of cases about to disease entities.
Yes, the cases are in the write-up, in the report. She explains the problem, what it is, and the rates, and the rates are given in the dissertation. So she didn't present it here, but it's an issue. It's a problem in that part of the hard-to-reach area in Ghana, in rural Ghana.
Please, can I ask Professor a question, please?
Yes, please.
Yeah, Prof, I wanted to confirm, was the study specified the settings? Maybe it's a districts or specific areas that it was conducted?
Yes, it is indicated that I need to go in, but the regions are there in selected Bono region of Ghana. You know Bono?
Yeah, no, Bono very well.
Yes, and then in the thesis, she goes into the detail, and she was saying that it is a hard to reach rural area. So she has described them in the thesis.
All right, it'll be
Okay.
interesting to see.
Right. Thank you so much, Stella. Matthew, are you able to present? Or are you maybe you're still having connection issues?
Hello.
Yes, we could hear you and see your screen.
Hello. Hello.
Yes, Matthew, we can hear you. Can you hear us?
Okay. Pardon me. I could not invited because at that time I was in school, I was busy and I could not follow it. So it was just random that I saw that you have posted this, but this is how my presentation looked like. In all, my mentor was Rashri. She's also a SBC expert, and I'm also a health promotion officer. That's SBC officer at the national level. So in all, she took me, we did not concentrate only on one area. So she took me into a lot, multiple of areas. So the first area that he took me through was designing and evaluating SBC programs, and then sharing stories and experience from practice, and then networking with others. And then he also, our last topic that we treated was guidance, career guidance. So in all this, what we did a program design and evaluation. We use LF as a case studies, and then we drafted some key messages in it. So we saw the definition, the importance of the evaluation process and the type of evaluation. We have the formative process, the outcome, and then we developed, we also went into how to develop SBC indicators. That is looking at input indicators, output indicators, outcome, and then impact indicators. So that's through that one, we were able to go through how we can develop a concrete and SBC program, and then be able to implement and monitor it. And then we also learn, we also share some stories, some past experience. So with that, I was given an assignment to write on a past experience that I've gotten on the field, and I wrote on refusal or barriers of schistosomiasis medication in a community in Ghana called, in the Western region called Eshim. It was a mass drug administration, but because the SBC activity did not go on well, the community refused the drug uptake, and then you have to go in and then start the SBC again before the community were able to accept it, to share the experience, field experience. And then I wrote, and he also made an input on how best that next time I can also replicate it. So the challenges, the real impact of well-funded project, and then he encouraged the continuous learning adoption. We also look at Ghana has gotten a outbreak of cholera. So we also went into how we can report on the cholera. So that went to, we did a lot of cholera outbreak. As at the time that we were going through the cholera outbreak, we were having about 4,000 cases that had been affected with cholera across 4 regions in Ghana. So we went through, and then how best that we can report on we can report it internationally, and then seek for other people to come in for SBC activities. Though it was not, it's not an NTD program, but because it is something that came out and then we were suffering from it, so he also helped me to how I can best design or present the cholera cases. And then he also got me on the emerging global health, emerging career guidance, and then the opportunities in the research how I can tap into it, and then also write for conference presentation and abstracts so that I can be sponsored. And he showed me a list of NTD NGOs that accept proposals and abstracts, and how I can be able to tap in and then write to publish internationally. So with that, we are preparing to even write or develop conference presentation or abstracts that can win international presentation so that I can go and present or publish internationally. So our next step was to develop proposal for SBC activities on NTDs in Ghana, and we are working on it now. We have an NGO that is helping the NTD program called Search Savers. They want to develop SBC activities on LF. So I have tapped into it, and I'm developing a proposal that Rashri is guiding me on how I can go about it so that we can win, we can get a winnable proposal so that we can get a sponsorship for SBC activities on filariasis across the nation. So it is in the process. And then we also want to develop a conference presentation or abstract that can win a conference presentation, or that can be called internationally or published internationally. My last thing is the acknowledgement. I acknowledge the iCHORDS for giving me such opportunities to learn from my mentor. And then secondly, I also thank my mentor, that's Rashri Das, for his time and then energy spent and to mentor me so that I can pick it up to reach internationally, so that I can also become a future SBC specialist in NTD. So thank you. That's the end of my presentation.
Great, Matthew. Thank you so much for that wonderful presentation. We do have time for one question before we go to closing remarks. So does anyone have any questions or comments? Yes, go ahead, Carlos.
Good afternoon or good morning, everybody, depending on where you are. Thanks for the presentation. One general question. You said that you're developing an SBC proposal for LF. What are the initial components that you are conceiving for this intervention?
Yes, we are considering the barriers or the factor that we are considering factors as a barriers that prevents the uptake of LF medication and then surgery. You see, in Ghana we have the hydrocell, which is part of LF. We do LF surgery, that's hydrocell surgery, but a lot people do refuse the surgery, and then we also do mass drug administration for LF. That is the ivermectin and then the albendazole. During that, you do it twice in a year. During that period, people do refuse. So we are looking at barriers or the factors that contribute to the refusal of those medications. So we are looking at sociocultural factors, cultural factors, we are looking at individual factors, and then we are looking at social factors and system factors that contribute to the refusal, so that we can develop SBC, tailored SBC materials or tailored SBC, SBC, yes, for that one, so that we can break those barriers to increase the acceptance of the medication and the surgery.
All right, so Tadjidine, you have a few seconds to ask your question, so if you could just make it very brief.
Thank you so much. I just wanted to know what type of schistosomiasis we talk about here. This is hematobiomycosis urogenital schistosomiasis or intestinal schistosomiasis in Ghana?
Yes, in Ghana, we have all the three types of the schistosomiasis. That's urinary tract one, and then the one with the column, and then we have female genital 1, 2.
Genital.
But
genital.
the one that I'm talking about is the urinary tract. Urinary
Okay.
tract 1. The community is in one of the urban districts, but it's a rural community. So for some time being, there had not been any administration of that drug there, but later on it was discovered, or it was established that there was, some cases were reported from that community. So the team went there to do the administration with that proper SBC activities to prepare the people. So when they went, the people refused, and then less than 20% accepted the medication. So later on, we were called as a SBC team. So we went there, but then I was the district health promotion officer there. So I was called, and I led that program into the community. That we did a lot of community engagement. We did sensitizations. So the Queen Mother and was used as a champion to champion this after he has been well explained and understood. So he championed the issue and then sensitized the households during the community deba. So later on, about 95% accepted the medication because they were thinking that in Ghana, fertility issues fertility is an issue. So they were thinking that, or they had the rumor that it is an infertility thing that we are giving to the children so that they cannot reproduce, and they prevented their wards from accepting it. So that led to the mass refusal. So after being well established and then well explained to them, then they got the concept, they accepted it, and then henceforth they have been accepting it.
All right, thank you so much. Sorry, Tadjidine.
Forgive me. One second. Just this refusal has this refusal has consequences about blood cancer of bladder cancer?
Please, if I get you, you said that does it have blood cancer or not? Please, I not get the question.
You have some cases of blood cancer?
No, we don't have blood cancer, but in Ghana, where the cases have been reported, we do education, and then we do mass drug administration as I.
So sorry, I'm gonna have to cut this off right now. We are running out of time. You can answer any of the questions in the chat, Matthew.
Please, I also have question on the chat box.
Okay.
Yes, so ask your questions in the chat box and Matthew can reply. I'm gonna now pass it over to Allison so she can say the closing remarks. Thank you.
It's wonderful to see all of the dynamic conversation happening. So thank you. Oh, sorry. Thank you so much. Yeah, thank you so much. I would be delighted for you to continue the conversations offline and continue your questions. I want to just say thank you so much particularly to our mentors. This program runs well because our mentors give of their time to support the mentees. And so I want to just say thank you particularly to our mentors and for the efforts and time that you have spent over the last 6 months. Also across time zones, and I know we've got Rastri, is in India, and Matthew is in West Africa. So just amazing, for example, just to see the commitment across the different pairs. So thank you to you all for taking the time to support the program this year. And thank you to our mentees for sticking in the program and for being organized and connecting with your mentors and doing the work that they asked you to do. So a huge round of applause to you all. You are what makes the iCHORDS mentorship program work, and to Varsa, of course, for her efforts in coordinating it all. I like to say that at different points in our career, we are mentors, and at different points in our career, we are mentees. So for those of you, when we launch the next round next month, please consider coming back. Consider yourself as a mentor or a mentee. Depending on what questions you have to ask. So stay tuned for more information on that. One other thing, we'll be sending out certificates to everyone at the end of the call. So to thank you and recognize your participation in the program. And the last thing is next week on March 6th, we will be having a webinar for iCHORDS, a virtual conversation with Dr. David Addis. So would welcome you to join. Varsa has posted the link there on how to register. So hope to see you there. And we will continue to promote this program. It's something we want to grow. So thank you to you all. Thank you to our steering committee members who joined the conversation today. Really delighted that you could be here. So thank you very much. And please do continue the conversation online or in between the different pairs. So thanks, everyone. And thank you, Varsa, and have a wonderful afternoon. Great. Or evening, wherever you are, or morning. Okay, thank you.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.
Thank you.
Bye-bye.